Good afternoon. Thank you for attending the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and safety, but we also understand how important it is to provide relevant and robust continuing education to Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. If you would like to submit a question to the speaker, please use the Q&A feature in the virtual platform. This session is accredited for 3 hours for the following: social workers, clinical credit; nursing contact hours; AMA, PRA Category 1 credits; peer support specialist; psychologist; licensed professional counselors. Full participation is required to receive credit, and we will be monitored throughout session. You will receive an email from Women's Foundation with detailed instructions on how to claim your credits and access your certificates. Additional information is available in the digital event booklet. Tracey Lilly has no financial disclosures. None of the members of the symposium's planning committee or any session moderators have any financial disclosures. This session is entitled Strategies to Develop Self-Care Skills to Manage Environmental and Compassion Fatigue. Our presenter is Tracey Lilly, who is an MSW and BACS LCSW. She received her BSW in 1990 from Louisiana College in Pineville, Louisiana, and her MSW in 1995 from Louisiana State University. She began her career at LSU in 1996 as Assistant Director of Field Education. She was promoted to Director of Field Education in 2002 and has served as Assistant Dean of Field Education from 2005 to 2012. Her role changed to Associate Director of the School and Director of Field Internships in August 2012, when the school became a part of the College of Human Services and Education. Prior to her tenure at LSU, Ms. Lilly worked in the area of mental health and family services. Her continued areas of interest are mental health issues, family issues, parenting education, gatekeeping, social work ethics, and retention of new social work professionals. With that, I introduce you to Tracey Lilly.
Thank you so much for that introduction. I'm going to stop putting the year though, for somehow when I hear 1990 and 30 years hits me in the face, I'm not liking that. So from now on, my bio is not gonna have the dates. I think I'm just gonna take it out to do it. I'm so glad to be with you. Thank you for the invitation to share at the Behavioral Symposium. I'm glad to be here. Certainly not how we thought we would be in person. And so I know for many of you, you probably are joining us because we're virtual. That's one of the things I've learned is that we get more access. It's easier to join in and do things. And so that's one of the benefits of virtual. But for someone who presents a lot and likes interaction, not so much. And so some of the activities that we would normally do has had to change since we're not in person for you to have some of those small groups. There are a couple of things that I'm going to share with you that I'm going to want you to do after. And I'll kind of hit it a couple of times just to kind of get you an opportunity to kind of educate yourself since you didn't get a chance to do this before, or we can't do it when we're in person. So I'll share that too. So I also shared with we have several people in the room, but I shared with them that I had brought my real shoes, my professional shoes to wear, because I haven't really worn real professional shoes probably since about March 11th. And then I realized no one can see my feet. So I'm so glad I wore comfortable tennis shoes today. So probably more than you wanted to know about me. So my name is Tracey Lilly, and I love working for the school. I've been a social worker since 1989, and I love social work practice. I love being in a profession that helps. I love working with all the disciplines that are probably represented here today and working it. But one of the things that I've seen when we talk about retention, I know Robin mentioned one of my areas of interest is retention of social workers. One of the things that we do not sometimes do well personally, and sometimes as organizations and maybe as a profession, we don't do enough to talk about self-care. We may talk about activities and we may talk about doing things that are fun, but we are not intentional and purposeful in creating our understanding of that it is as an important of a skill as any skill that you learned in your degree programs. I'm going to tell you, if I am not taking care of myself, in my mental health, particularly physical or whatever, I am not going to be able to do things for other people. And so we're going to kind of break down some things today, kind of, I think maybe things you've heard before, because there's a disconnect between knowing and doing. And so some of the things we're going to talk about today, it's not going to be a secret, but I really want you to think through first, how am I incorporating that in my life right now? And secondly, I want you to think about things that sometimes we forget that impacts our work as professionals. What a perfect time for this. When this conversation first started, we were not in a pandemic. We were not in a virtual world where we felt so disconnected. Even today, walking in, you're not sure how to greet people. People that know each other, maybe normally would hug. They feel a little bit of distance. I've seen some elbow bumps. There's an awkwardness of feeling that connection. And so the pandemic, not only has it just changed everything, it really has changed our connection and how we work. My office now is about 10 steps from where I sleep. And so having that natural boundary between work and life has been different. And I think that impacts self-care. I think there's also just in our communities, just the tension and the struggles that we feel that are so palatable with social justice issues. I think as our community is more polarized, as our state financially, obviously we just had a natural disaster. There's so many things for those that work on those front lines and those helping professions really have been impacted in such incredible ways. I also think it's really important for us as we're going to talk today is to really be cognizant that what we're talking about today is not an activity. We may talk about some things that I encourage you to do, but when we talk about self-care today, it's not about an activity. It's about an attitude and awareness of how incredibly important this is to maintain our own self-care for us to be able to be effective in the work we do. I'm going to also do a couple of disclaimers. One I'm going to show you in a minute, but the second one is that sometimes going through this information will bring awareness to ourselves that we are in fact dealing with some burnout or compassion fatigue, and we'll talk more about those definitions of that and what it looks like. I want to encourage you, if you recognize those things in yourself today, that you reach out. What a better opportunity than a behavioral symposium to remind us of the resources we have in our state. But you, even as a helping professional, you may recognize some things today that you did not anticipate. And so I just want to say that at the beginning, when we get to the end and Robin takes questions, I'm going to say this again, that I really want you to be thoughtful. I'm hoping this is encouraging to you, but I also know it's going to be informative. And so at the end of it, if really some of that information has made you aware, gosh, this was a little too close to how I'm feeling right now, I just want to remind you there are resources and supports to be able to work through. So we're going to go ahead and get started. I'm going to tell you I'm on my 9th day of training. And so if you see me taking a swig, I'm so sorry. I will try not to let that be distracting to us, but I'll have to. So today is strategies to develop self-care to manage environmental and compassion fatigue. I don't have my glasses on. She's trying to be sneaky, but I don't have my glasses on. Very good. I just told you I'm my age. I can't see that close up. And if you'd have showed it to me, I don't have my reading glasses on, so I couldn't have read it there either. So, but strategies, I want to tell you, I want you to pay attention to the word strategies, okay? Today is all about encouraging you to incorporate this into your practice. It's not just for me to do a little rah-rah cheer, we help people, hope you feel great about it, although I can do that. I want you to know, I want us to leave this place and time with us thinking very concretely about some strategies that we need to incorporate. So just to give you a little bit, I know that you probably know, you've read about the course description, but I really want to tell you, we're going to talk about some definitions. I think we throw words around like vicarious trauma, secondary trauma, compassion fatigue. We're aware of those, but sometimes we don't know how they work together. I think sometimes we forget the daily impact that those things have on us. So we're going to make sure that we take a minute to really look at what those things mean. We're also going to look at recognizing them. Not every person demonstrates compassion fatigue the same way. And so we're going to talk about how that can be individualized, but there are some risk factors to it. We're also going to look at compassion satisfaction. I think sometimes we don't talk enough about it as in relationship to a balance with compassion fatigue. And we're going to talk about just some overall well-being. I told you the first disclaimer, you may or may not be able to hear this. You may only be able to read the captions because of it being embedded in my PowerPoint. You may not be able to hear it, but I want you to pay attention to the captions if you cannot hear it. And then I'm going to do my second disclaimer of the day. And if you can't hear it, the phone is ringing. All right. We were sitting in my home. I have 2 adult children. We are watching The West Wing, and this little short video came on. So we're watching it, and after it plays through, I noticed that my husband and my 2 daughters, they're looking at me laughing. And I was like, what is so funny about that? And they're like, you are him. You know, you say you're going to step away. You say you're taking a break. You need to relax. But yet you're just constantly on your phone. You're doing something. So we were just laughing. And it became kind of a laughing moment for my family. And then all at once I started thinking about it. And I thought, you know what? Is that what I do? Do I not step away? Do I not put my phone down? Do I really say when I need to take that break, do I take that break? Do I really take care of me instead of always trying to take care of other people? And so what came to be kind of a silly kind of joke in my family became a moment that I really had to think through. But I say a disclaimer to you because I'm going to share this with you today, and I am right with you. Some of you probably already do this much better than I do, but I'm going to tell you, as I move into my career, and particularly as I see young social workers in my class and working with them on campus, I realize this has to be a part of their skill development, or they are not going to be effective in what they do. I will also say, and I told my class this morning, I taught this morning, the world they're going to enter in mental health and working with families is not the same one that I stepped into 30 years ago. It's a different place. For example, we were talking about social media, and I am having to work with families right now that are just struggling because of apps for their kids. It's predators. And so I'm having conversations and having to learn about these apps that really do put these young people at such risk of predatory behavior. That is not something I had to do. And I'm just saying the world is a different place. And so we need to make sure that we currently practicing are ready to deal with it. But I do think the generation behind me, we need to make sure that they are better fitted to do this work. So as I was getting ready for this presentation many months ago, Charles Figley is just renowned in working with compassion fatigue. And I remember thinking, that is so odd that when I was in graduate school, why didn't they teach us that? I mean, really, they were negligent in not teaching us that because that is such an important concept. Well, when I started getting in and looking at the references was after I graduated from graduate school. And I realized because he didn't term that until I had graduated already, that is the reason they didn't teach it to us. But a little humble pie on that one. But I'm going to tell you, I think it's as important as anything else. I know many of you are social workers and many of you are not, but this is our mission as social workers. And I know that our other professions next to us have similar impact in words like enhance well-being, meet basic human needs, working with vulnerable, oppressed, living in poverty, environmental forces that create and contribute to problems just in living. And I highlighted those words because those are not unique to social work. Anyone in a helping profession finds themselves working with these populations, just being exposed over and over with social justice issues, being exposed every day to systemic poverty and the things that you see. And the work I do, those that have some challenges in how we treat people, and they have been victimized and traumatized in so many ways, these things impact us. But you know what? We have stepped out and said we want to do it. And I'm going to tell you, I knew what I was getting into in regards to working with the population, but I can tell you I had no idea how hard the work was going to be. No idea until I started doing it. And so this is where we're going to land today to look at some things. What is the practice impact of self-care? Obviously, social work by its very definition means working with vulnerable patients and those have experienced trauma. Just like whatever profession you're in, very seldom do we do work that someone comes in and says, yeah, I'm doing great. Life is good. Things are going, got everything I need. I have plenty of money. Everything is great. That's not who comes and is with us. The people who we work with come to us in some capacity of need or pain or illness. Something is going on that has some level of sadness and hurt, rawness, vulnerability, whatever it is. So we know when we enter that room that it is going to take from us. It is that energy that we give in those situations. It's emotional, mental, spiritual, physical, and financial, and how it impacts us. I say financial. I laughed when Robin said, I have no financial disclosure. No social worker would ever say they have a disclosure financially to do, as with many other professions. So what are some of the reasons that our practice is impacted, and we need to really be thoughtful of how we take care of ourselves? First is the focus of the work we do. I said it is complex work. It is difficult. And I'm going to say, I think probably more. I thought at this point in my career, I would say, I have seen it all. I feel like I'm capable of doing whatever comes through the door. And I'm going to tell you, family situations get more complex. I had a family not long ago. They were having some family disputes and we were talking about carpool. There had been some issues. They had 8 parking tags because 8 different people picks up that child because of the family drama and dynamics they have. Things are much more complicated than I think they have ever been before. Just a lot of conflict. I think the nice thing for us is that people are more aware of mental illness and how it impacts us. But we also sometimes have more prevalence of some of anxiety and depression. And so that is a part of our normal now. We also do not have to spend much time to talk about systemic issues at this point. We see it in all the work we do, all the isms that we see. Besides racism, ageism that we see. I mean, there's sexism. There's so many levels that we work with that may personally impact us, but also impact the work that we do. Also, right now, I'm going to tell you, Zoom work is more exhausting than in person. I love the ease of Zoom. I love that I can look like this on top and have pajama bottoms on and nobody knows. There are many elements of good that comes from virtual, but I am telling you, it also is exhausting. There are studies that talk about Zoom exhaustion, and I encourage you to stay aware of that because I think that right now, our number of clients that we see and the energy that it takes to see them can be exhausting, and we need to be thoughtful of learning new systems because many of you probably are doing telehealth services and you never wanted to. You didn't really say, hey, I think I'd like to do this. Let me do some training. Let me get acclimated to it and then do it. You found out on March 11th, hey, we're going virtual. You're going to be giving services next week. And so you were thrown into giving services that really you may or may not have chosen to do or felt adequately prepared to do at this time. We also have a new digital world. So we are constantly, I'm telling you, it takes me about 5 minutes to just get my day started after I sit down, putting in passwords. I have to have something to get me in the gate. I have to have something that gets me in the building. Then I have to have something that turns on my computer. And then if I go to this area of work, I need this password. If I go to this area, I need this password. Just electronically, it does help us, but it is an added layer of stress. Also, I love working at LSU. I love it. I am a lifer at LSU, but I will tell you, we also love changing systems. I don't know about your organization, but just about the time I get acclimated and good at doing something, we change it in something new. And you have to learn how to do that. And I'm not talking about learning how to be a social worker. I'm talking about learning how to just do my job from a logistics place. And so that can cause stress on us too. We also are not immune to life in our own hurts and our own struggles and trauma that we talk about. So when we talk about self-care, it's also because we know many times our lives are going to be kind of parallel to that of the clients that we serve. We can go through hard times. How do we prepare for those things? How do we respond for them? As we talk about compassion satisfaction a little while too, I think it's that thought of most of us went into a helping profession because we wanted to help people. But I think sometimes, you wonder, am I really making a difference? Does it matter that I showed up? I feel sometimes the work I do, I'm on a treadmill. I am working really hard, but it doesn't seem like we're going anywhere. And so sometimes if we don't have some anchors for us, we can get caught up in that treadmill and it can be exhausting in the work we do because we want to make a difference. I have the question that you see, what is wrong with people? I'm going to tell you, I've heard myself say that very often over the last few years. I do some volunteer work with families going through crisis. And there are times I walk out and go, what is wrong with people? What's going on? And so we're going to talk about how that experience can impact us in the work we do. The positive is that we know those stressors are there. We know they're a part of it. How do we work past it? Some of the professional stressors we have is that we have reduced services for clients. Sometimes when our state goes through financial challenges, it's filling those gaps, getting access to services, not having as many referral agencies to do. I know through the years we've gone from, trying to not have as much institutional long-term care, but yet some clients need long-term care. So we're constantly trying to figure that balance out. Obviously, more with less. That's a mentality that I've never agreed with, but it is certainly part of our subtle culture at times. And I'm telling you, we were already probably doing more with less already. And so that mentality can be stressful for us too. Working with multidisciplines, feeling like your territory has been infringed on, making sure, so we're constantly kind of elbowing other professions and how important it is for us to learn to work cooperatively with that. Also, I mentioned earlier just about technology. Technology is meant to connect us, but in many ways it can make us more disconnected than we were ever before. I had my students do an assignment one day and they had to go somewhere in public. They could go sit in the mall, and this was before COVID, sit in a restaurant. They had to do something, but they had to observe people around them and their use of technology. And they were like, okay, but I'm going to tell you, they were shocked when they came back. When they really started paying attention, most of them said they saw families sitting at a dinner table out eating together and everybody was on their phone. People who were sitting waiting to go in for a reservation were sitting there watching their phones. I do think that from a human behavior place, we have to be really aware that that has influenced even the word friends. When you think of friends, friends are not someone on social media. That's not what real friendship is. And so I feel like sometimes we feel more disconnected because of that. I think we also have some of the stressors of managing our ethics within a technology changing world too, and how we navigate those. So how are we going to spend our time? Giving you kind of the layout right now, kind of looking how we're going to spend our time. I wanted you to understand the context of what I'm hoping we're going to address. I doubt there's anything I said in this first 30 minutes that you were not aware of. It's just thinking through everything I talk about today. I want you to think through your lens. Your lens, how it's impacting you. Are you aware of the impact that it has? Because you are impacted. No matter if you want to think that you're not, some of those stressors do impact us, and we need to be thoughtful about that. Also, just reminding ourselves about self-care and the intentionality of it. And I'm also going to tell you that self-care probably has some waves for you. I understand there are sometimes you know self-care is important, but the realities of what's going on in your job or life, you cannot do it the way you want to. You're just trying to get through. But you know what? You can't do that long term. There has to be an intentionality at some point. Say, look, I know it's a hard time right now, but if I do not stop and take care of myself, I am going to crash and burn in some way. Being aware of those triggers, and everybody else, everybody around you has different levels. Self-care looks different for everyone. Some people have a capacity to maintain that level of energy for longer periods of time. Some people don't. I think you need to know yourself and what you need. I have a friend that she needs about 30 minutes every day of quiet. I tend to not seek those out. Quiet, I like noise. And so even if I'm in the house by myself, I like noise. But you need to determine what you need and be intentional about it too. I also want us to, before we leave today, for you to think about how you're going to incorporate some specific things daily into your life that is going to be able to give back to you in some way, add to your overall well-being. So that's how we're going to spend some of our time. I shared with you earlier that we're going to break down some of these topics and definitions because I think these things are so important. I think for myself, after doing years of social work, I'm more aware of it, but I don't think early in my career, I understood the cost of being a helper. I don't think I understood the cost of hearing and seeing things on a daily basis because we see some real pain. We see some real human suffering in so many ways. And I think sometimes we don't realize it until it impacts us or we look back. I did my first internship at Women's Hospital in Baton Rouge. In fact, many of you may know Susan Eaton. She was my supervisor at that time. And I can tell you that she would ask me often because we worked with all babies that were born that went to NICU, or we also worked with babies that were stillborn. And I was a 19-year-old kid just in social work, getting my BSW. And she often would say, how are you doing? Tell me about your experience. You know, how when you leave here, when we've had a really hard day, what are you doing? And I would say, I'm great. I'm good. I'm good. Well, at that time in the hospital, they had flags outside the door and they were color coded. So they would let the healthcare staff, and they may still do that because I haven't worked in the hospital a long time, so I don't know, but it would alert the person going in what level of care and what was going on. So I knew when there was a pregnancy that was very fragile, that looked like there may be a stillborn. And so we knew from the flags what those things look like. Now, I told you that was in 1989 that I was there. Fast forward to 1999, and I'm at Women's Hospital. I've had a problematic pregnancy. I've been in the hospital for 4 weeks due to my water breaking a little bit earlier. I was at risk for a couple of things happening. And all at once, I am going to have the baby. They put me in active labor. And everything's going great until it didn't. And they had to call a code and do an emergency cesarean. And so as they are taking me, I remember just vividly during that moment, the anesthesiologist is asking questions of the nurse, but I'm trying to answer him. He finally says, you're good. You don't have to answer me. That's probably my control features too, but that's okay. But the nurse is moving my head because I am turning this way, and she keeps moving my head, and she says, look, your husband can't come with you. Your husband can't come with you. We'll go get him. And I couldn't let it go. And she kept trying to tell me all the way till we got across and kind of turned to another hall. It wasn't until later that my husband was saying, Tracey, I heard the nurse keep telling you I was in the room. I promise I was there. And it hit me. I wasn't looking for my husband. I was looking at my door. I wanted to see my flag. I wanted to see what my risk was, because of being somewhere for 6 months, seeing the trauma and the hurt 10 years later flashed in my mind in an instant. We cannot do this work without it becoming a part of our story. I am blessed beyond measure that my story was not of many people I worked with. My 22-year now is finishing nursing clinicals and it's going to be a nurse practitioner. But I'm just saying, in that moment, you don't think that you're taking these things in, but all at once your mind brings you back to those moments. There's a cost for the work we do. Now, I have been paid tremendously well, not financially, tremendously well, with a purpose and a happiness. I wouldn't want to do anything else. But I learned at that point what Susan Eaton was trying to teach me is that we had to take care of ourselves, because those traumas that we see become a part of our story. I don't know what you've seen. I don't know what intensity that you work in. Some of you probably work in emergency rooms every day and are seeing things. So we're going to break down some of these definitions that we sometimes skip over pretty easily that we know. I want you to think about them today, not just in definition. I want you to think about how they impact you. I want you to put stories together for yourself. I think that's the reason we have colleagues. You know, I had to get a lot of support for 5 years. I did work with sexually assaulted women that had been sexually abused. And I would have said that work didn't impact me a lot either until I had 2 girls. When I had 2 girls and 2 daughters, and the first one asked me to go to slumber party, and our life stopped because I wouldn't let her go. And my husband said, you know, I think you may need to get some help about this. And I said, you cannot unknow the things you know. You cannot unsee the things you see. I wish I could be ignorant like you, which you can imagine that went well. But it's easy when you haven't heard those stories to not think the same way. But I had heard too many stories that started off, well, I was at a neighbor's house. I was at my friend's house. I was at a slumber party. And I just wanted to protect the access to my children. And I realized things impact us. So I want you to think through, what is your understanding of that, and how do you use that in your practice? One of the first ones, shared trauma. Obviously, right now, we have a whole communities around our state that shared a trauma. So let's say you're a social worker at the Community Mental Health Center in Lake Charles, and you lost your home. And you're going in to do the work, and you see person after person that they also lost their home. We need to be aware many times we share the same trauma that our clients are going through. Can you do work and experience the same thing? Absolutely. But you need to be aware of how it's impacting you. You also may need to step back sometimes. You know, I know when my dad was in hospice, I had to step away from helping people who had terminally ill family members because it was just too close to my own experience. You're going to need to make sure that you are aware. Certainly natural disasters, violence in the community, pandemics that we're under, certainly the flood of 2016 in our community here, grief. There are so many things that will run so close to what clients actually experience too. We also have things that have happened prior to us choosing this profession. You know, there are things in our past and our situations that we've had that we need to be very thoughtful about of how that's going to influence us, because sometimes that's the very thing we're drawn to. And so we need to make sure that we've done our work. We have our support systems in place to help us continue on our healing journey before we jump in to want to work with those that are experiencing the same thing. And looking, oh, I'm sorry, I hit the screen. We want to make sure that we also include this in our agency work. If you're an agency supervisor, I'm going to mention several things. Not only do I think it's a personal responsibility about self-care, but I think our agency supervisors and organizations need to understand how important self-care is to maintaining the well-being of our employees. And look, even if they don't want to do it on a human level, They need to do it for a financial level, because let me tell you, you having new people or revolving door is a cost to you that you don't want financially, and it's a cost to the clients that we serve. So our organizations need to embrace this too, that we need to create spaces in our organizations that we pay attention and we provide support for that to help mitigate the things that impact the people that we work with. I'm going to tell you, I think organizations, some of them do this really well, but I think they're few and few between who do this well. We do have across the country, people have really adapted this and have dealt with retention and effectiveness of workers and satisfaction of their workers. And I think sometimes we're not doing as well as we need to. Said very respectful for anyone from LSU listening to this. I know that we can do a better job in some of the work that we do. Vicarious trauma. You know, to me, you see Perlman, Savecny, you see it on your power slide. You see that it's that profound shift in our worldview. It shifts how we think about things from the work that we do on a daily basis. This is sometimes when you hear things like, I get a little jaded. You know, I'm just kind of tired of working people. Those people, whatever those things come out, that is part of that doing that work all the time with people. It can shift profoundly our view of the work we do. It can impact our beliefs. You see an example of some of that. A domestic violence shelter worker may stop believing that there are actually people with healthy relationships. In my volunteer work, I do a good bit of work working with couples that there's been a infidelity in some way with that couple. And I can tell you, my husband can always tell when I've had several of those cases, because he'll go, I'm good. I wouldn't leave you, not cheating on you. I'm good. Because I can tell it kind of shifts me. And I'll say things like, oh, everybody cheats or whatever. And he'll go, hold up. But it can profoundly impact us that we do that. A child abuse investigator may lose trust if anyone who approaches their child is meant to harm them. It really can skew the way we see the world and being, you know, the signs are being negative in our outlook, loss of hope, emotional numb. To me, a little self-loathing, feeling overwhelmed, withdrawn, anger, bitterness, which are not on there too. But vicarious trauma is that over and over of hearing really difficult things. And all at once we shift sometimes how we think, and we think it's all or nothing. Okay, we need to be careful about that. But I'm going to tell you, there's no way that we can do the work we do and it doesn't impact us, but we need to be aware of it. We need to hear those triggers. We're going to talk about this in a little while, but I also think it's so important for you to have an accountability person. You need someone in your professional life that will say, are you okay? You just don't sound like yourself today. You know, for the school, I handle most of our discipline issues because a lot of those things happen in field. And so I have to deal with a lot of situations, and I'm creating the policies to do it. And I remember one time we had to expel a student, and they challenged that decision. We had to go through the whole process at LSU. And as we were walking back, our dean was with me. And she said, you don't seem very happy or relieved that was successful. And I thought about it for a minute, and I looked at her and I said, you know, I'm very glad that our policies did what they were meant to. I embrace being a gatekeeper. I know that it's an important piece that I do. But the day I am excited or happy that a student is not successful, I need to leave. And I think that you need to put that in any of your practice settings. You know, if you're not moved by human suffering, if you feel like you've lost a numbness to people suffering, or you have gotten caught up with some of the systemic isms that we deal with about a population, I'm going to tell you, you need someone around you to say, that doesn't sound like you. That doesn't sound like what you should be engaging in. Tell me what's going on. And you need to process, you need to talk about that, and you need to recenter yourself in a place, because you know what? If it starts impacting us this way, we cannot be effective. It's not going to be good for you, and it's not good for the people that we serve to be able to do that. But it's real. I don't know if anybody can do this work and escape it at some point. I just think it's a reality. I think you're normal. I think you're human when you have those moments. But if you set up camp there, that's where we get into problems. And that's the reason you need those people around you to say, hey, I'm concerned about you. You don't sound like yourself. Let's take a step back in what's going on. So you need that awareness. Secondary trauma can sometimes be one event. It can be a series of events. It may be one event that you'll see. It didn't directly happen to you, but because you heard or saw parts of it, it has impacted you. So for example, for me, in working with women who had been sexually abused, our goal of therapy was to have them go through their story because we were trying to help them restory so that instead of seeing themselves as helpless and a victim, that we see as survivors and in control of what happens. So we had to hear their story, and sometimes they gave very, very specific details. And I'm not a reader, but I know many people are. And I know sometimes we have an image of what, if we read a book and then it becomes a movie, we go, yes, that's exactly who that was going to be. Or you go, no, that doesn't look anything like what I imagined. Because when we hear things, our mind visually sees it. And so sometimes when they would tell these stories, I would visually see the trauma happening. Those things can impact you. If you do work in a hospital and someone comes in and they have attempted or successfully committed suicide, you may not saw the event, but you see them in the pain and the hurting. As you're doing hospice work, you're seeing the physical deterioration of that body. We see things through secondary means in what we do, and we have to pay attention to that. You need to pay attention if that event has you not sleeping, you having where your mind won't stop and you keep seeing it, having nightmares, things popping up. For me, it was in a middle of a football field where my daughter was going to a slumber party, and I saw that her best friend, her brother, who was 14 at the time, was also going to have some friends be with him and spend the night. And I looked at the mom and I said, well, what's your plan having both of them there? And she goes, oh, I'm going to have one in the playroom. Oh, believe me, those girls don't care anything about those boys and they'll be fine. And I'm like, no, that's not going to work for me. You need a plan. And she's like, what do you mean? I said, you cannot have 12-year-old girls with 14-year-old boys in the same space. How are you going to keep them separated? And she became very angry with me because I insulted her. She's like, I wouldn't let anything happen to, and she said my daughter's name. And I said, I wish that I didn't think that, but I do. And I'm going to tell you, when we went home, I realized that how much it had impacted me too. We need to be aware of it so that we can respond to it the way we need to. And no, if you're asking the question, my daughter did not go and spend the night that night because I'm sorry, I can't unknow the things I know. But I got to talk with the mom. I got to explain to her that you had to think through risk factors. You had to think about some things differently. But I'm going to tell you that work changed how I looked at things. And I don't know what type of secondary trauma you may be exposed to. I don't think you can be in a helping profession and not ever been exposed. Think about how that's impacted you. Sometimes now I just think about the people. I think about it in a more positive light. I think about the difference that were made. I think about them surviving. But if you're having nightmares, you're preoccupied with it, you really need to listen to that of what's going on. The next topic is compassion fatigue. Compassion fatigue, we've heard about it. And certainly Charles Figley is huge in giving us some of that information. It's that negative aspect of our workers as helpers. Okay, all at once that we used to enjoy seems burdensome. It's tiring to do the work that we do. I say it easily is you get tired of helping people. I mean, you're just kind of worn out. You just kind of feel like you don't have anything else to give. Your tank is empty, whatever verbiage you would use in doing that. It certainly has areas of exhaustion, frustration, anger, depression, just that typical part of what we're going to see in a few minutes that can lead to burnout to be able to do. Compassion fatigue is the negative aspect of helping those who experience traumatic stress and suffering. If you're in more of a medical field, just seeing human suffering over and over again, we can find ourselves in that places of compassion fatigue. The negative aspects of working and helping systems may be related to providing care, maybe doing those direct services that you do. You just get tired of doing some of that direct care for the clients and patients that we work with. Sometimes it's the system that will, and we're going to talk about that more in a few minutes, the system will sometimes wear us out too in the work that we do. Many of us maybe work in systems of bureaucracy or things that change all the time, and it can. Sometimes work with colleagues. If you're working with colleagues and you feel like everyone's not on the same page, that everyone is not moving in the same direction, not everybody has the same level of investment, it can be exhausting. And we sometimes, one thing about this kind of environment, toxicity can happen and it can spread through groups of people. Okay. My husband used to call it the pot stirrer. In environments all at once, that can kind of become something that really impacts us. And it also can be beliefs about ourselves. Our fatigue may not always be directed to other people. It can be directed in us that we're not good enough. We're not making a difference. We're not trying hard enough. Whatever it is, you fill in the blank. But sometimes that compassion fatigue can be directed to us in what we do and thinking we're not able to do what we need to do, or we're not doing effectively in the work. We said it earlier that sometimes hearing yourself say, what's it worth? Why even try? Nothing I do makes a difference. It's kind of giving in to that attitude of that you're not making a difference. Some of the symptoms of compassion fatigue. This is where I said it at the beginning. If you start recognizing some things in yourself, I want you to pay attention to it. Note to self that, and we're going to talk about at the end. We'll take some questions from that Robin, you can send her, but really looking at getting some supports for yourself if you recognize some of these things in yourself. Anxiety, depression, being fearful, a startle response, being apprehensive. And I want to go back to the startle response for a minute. Sometimes it's just that being keyed up, that nervous energy that you have, that things just startle you. Apprehension, anger, desire to retreat or avoid interacting, maybe with messages and emails. You can't even hardly put yourself out there. You just are tired of paying attention. You're tired of getting the emails. When we first went to remote, I could not figure out how to make my computer in my office stop dinging when I got a email. And at some point during the night, even though I had it turned down, I thought I was going to have to throw my computer outside because mine was not compassion fatigue. It was exhaustion, but it's those things we just want to stop. We don't want to know anything. We're tired of looking. We don't want to be accessible. And of course, that's a little bit of the environments we work in now. Since we don't have natural walls of offices and days of the week, sometimes we could be more accessible than we would like to be. We'll talk about that in a few minutes. Being tearful. Maybe sometimes when a client's talking, you normally wouldn't be tearful, and it may be not even think horrible they're saying, you yourself find yourself tearful just in that situation. Feeling helpless or hopeless, that kind of goes along feeling that you're not making a difference. Intrusive thoughts or memories of events or situations that may come from that secondary trauma sometimes that we have. That secondary trauma symptoms that we have, it can come through on that. Also just poor concentration. We have trouble. Maybe we're sitting and we're doing an intake with a patient and we keep having to ask questions because we kind of zone out and we're not listening, we're not paying attention, and we can tell our attention has really diminished. And then obviously inability to perform the work that we do, just being ineffective in what we do. I think for myself, and I certainly think in medical, it can happen, but I think in mental health, We have levels of effectiveness. Sometimes we're much more effective than other times. But when we find ourselves kind of overwhelmed with some of these symptoms of compassion fatigue, we may not do harm, but we're not effective. Okay, we could do harm because we're going to miss some of those triggers or those flags that are incredibly important to see. But we also can just become ineffective at developing rapport and really that client feeling and having faith that what we're going to do is going to be helpful to them. We're going to look at two different things now. Compassion, satisfaction, and burnout. Everything we've talked about before is what attacks compassion, satisfaction, and can lead to burnout. That's why we're going to look at it in that way to be able to balance the two. This is the area I don't think we talk enough about. I think we talk about some of the challenges. I think we talk about those things that we see, but I think compassion, satisfaction is something we need to spend some time on. I want you to remember what really was the reason that you got into the helping profession. You know, I think it's really important for us to remember that satisfaction you get about helping people. I tell our students all the time, because of being a social worker, many times people don't really know what that means. Even people that have been in my life a long time still don't know exactly what I do. But I also get a lot of negative, and you probably do too. You know, I'll have people go, oh, that must be so hard. Or they'll say, man, I can't do that. I am way tenderhearted. Man, that would upset me every day. As if I'm hard-hearted and it doesn't bother me at all. I don't know what they're thinking. In fact, I unfortunately have negatively responded that way one time. I did tell someone, oh, it's easy. I'm so hard-hearted. I really don't care about people. It's easy. And they looked astonished. And I finally said, how do you want me to respond to that? You know, of course I'm tenderhearted. Of course it breaks my heart to see suffering. And so after I got to step away from that a little bit, and actually it was right after Katrina hit, I really developed a better sense of that. Thank goodness that I'm not as negative in responding to people. But as I was seeing those first responders go in to really, they knew that it was horrific. They knew people were suffering. They knew that it was hard and that people were hysterical and upset. But you know what? They kept going. They kept going in. They kept getting people and keep bringing them out. And I remember thinking of images from 9/11 and looking at the firemen. And I started thinking, you know what? When you're a helper, when you're in a helping profession, you see the danger. You see the pain. You see the hurting, but you have been properly trained to understand it and to recognize it, to evaluate it, to assess it, to plan for it. You have been given the tools that have equipped you to go in. We are equipped to do this work. So sometimes when I get caught up into whatever it is, I have to remember not only did I want to help people, I am equipped to do it. I am trained to do this work. Now I may get off track a little bit. Life may get me off track. Some of the events of the clients I work with may get me off track, and I need to get myself back. But ultimately, at the core of my being, I want to be a part of a profession that helps people. That is what drew me in. I wanted to feel that satisfaction of doing something that mattered. I can tell you on some days, I probably do ask that question. What made me choose social work? I'm really not sure. I'm sure if you're a helping profession, you have thought of that. Maybe you've thought of that twice already today. You may have thought it while we're in this presentation today. But you're thinking about, you know, that's normal to question it. But in your heart of hearts, who you are, your foundation, you say to yourself, I want to make a difference. I want to be the person that sees that crisis, but I am trained and equipped to go in, and I'm going to go in. It's going to be hard to sit in a room with a family that is so raw from grief or pain. But you know what? It's an honor for me to be in that space. It is an honor for me to help them navigate what has happened. And so I'm going to tell you, I think we need to spend some time in remembering why we are doing what we're doing. I want us to remember why that we got into it and also the benefits of it. We can spend a lot of time talking about some of the challenges, but today I also want to talk about what are the things that we get pleasure from doing this work. What are some of the positive things that we do? I'm going to tell you first and foremost, it's the people I get to work with. I think one of the most positive things about being a helping profession that adds to my compassion satisfaction is that I am with like-minded people. So that when something happens in our community that is wrong, we are all on the same page. It's not right. We want to work towards a better situation. That I am in a group of people, when they see a client suffering and hurting, they want to do everything they can to make that situation better. They look at life, they live life, they prioritize life in a way that people are their primary purpose that we're here. And I love that. I would have never been I'm so glad that other people can do other things because it's what makes the world go round. But I know for me, that was not a part of it. That was not a part of what I wanted to do. And I think part of compassion satisfaction is being with a group of people who are like-minded. And I'm not saying we all think alike, because we do not. We see things in life differently, but at the core of who we are, we want to make a difference. And so when you're around people who have that level of drive to make a difference and see life as a place where you can impact it and make it better, I think that builds your satisfaction about the work that you're going to do. I also think it's the environments that we work in. It's organizations that their missions, excuse me, their mission is to make a difference. In fact, I encourage you, if you haven't looked at your organization's mission in a long time, I just encourage you to do it, because sometimes, maybe some people aren't watching that are probably in leadership, but sometimes the day-to-day of what we do, we can think doesn't line up sometimes with the mission of the organization. We need to remind ourselves what it is, because we need to be reminded of the purpose of us impacting those that are vulnerable. Remember, we talked at the very beginning, vulnerable, have basic needs, and et cetera, that they need to do it. One of the biggest positives and aspects of helping is that pleasure and satisfaction derived from helping people. You know, I'm telling you, I told my students, and this may seem a little bit exaggerating to you, but I find it a little addictive on my part. There's something about being with someone in their worst moments and having some small part of them being heard, being comforted, just being present with someone going through something. Because let me tell you, Robin was sharing with me for LDH, she works with suicide prevention. And I'm sorry, if you're with a family after someone committed suicide, there is nothing that you're going to say that's going to make that situation better. There are no words, but being present, them not being alone, normalizing it, giving them opportunity to talk about it. What a powerful moment in a horrible situation. You can bring something that's powerful and encouraging in that situation. And I'm going to tell you, there is nothing, I'm telling you, even after all these years, when I leave from a space that I know has brought some level, even if it's just this much to someone, it is something that I want to do again. I want to be a part of that. That's that compassion satisfaction. Because what we're going to see in a few minutes when we talk about burnout and we talk about some tools you can use, if you're not managing feeling satisfied, if you're not finding ways that you feel connected to that mission and that whatever it was that led you to do this work, if you don't feed that, if you don't encourage that, this other stuff is going to take you off balance. Okay. So when we talk about balance, and I'm just going to tell you right now, it's not 50-50. You're not going to see every week you do this work that you're just equally doing. It's kind of like a marriage. Anyone who tells you marriage is 50-50, I question if they've really been married before. I think if you hit 50-50 10 days out of 365, you're doing good. People aren't meant to have equal equations like that. You know, it's that constantly shifting to where some days LSU gets the best of me. Sometimes the work I do gets the best of me. But you know what? I have to watch it as a balance, and I have to make sure that it's constantly teetering like this. Because if I stay this way too much, it's not going to work. Because if I'm only getting and I'm not giving, that's not a good place either. You know what I mean? I'm sorry, I keep not touching my screen like I should. We need to make sure that it's balanced in what we do. But you know what? What we feed grows. What we feed grows. That is not my statement, but I don't know who said it. But it is one of those statements. The only one that I live with for more than that is by Maya Angelou, who says, when you know better, you do better. And I think as a helping profession, the more I know, the more I'm expected to do. And I say the same thing. What we have feeds. If you're an angry person and you feed your anger, you're going to get more angry. I do it with clients all the time. What you feed grows. So let me tell you, as a helping professional, we're the same way. What we encourage, what we spend time on, what we do, that is going to become an important part of what we do. So when you think of compassion, satisfaction, it is incredibly important to incorporate that thought in our self-care. You know, I have something on my desk. It's a little figurine of a little, it looks kind of like a child, but it's not really a child, I guess. It's kind of abstract, but she's all bundled up, like she's really hurt and sad. And I had a client give me that 28 years ago. And during termination, she said, I know you can't accept gifts. There is no value to this. Someone gave it to me a long time ago. I did not buy it. But I want you to, she knew I was getting ready to graduate. She was a client when I was an intern at LSU Mental Health. She said, I want you to keep this because I know when I came, that is what I felt like. But that is not me anymore. But I want you to put it somewhere in your office to remind you in the years that you practice that when people come to you, many times they're that way. But I want you to know I'm leaving it with you because I'm not that way anymore. And I'm going to tell you, there are some days I look at that and think, whew, it's the last time I felt that good before again. But I'm going to tell you, we need to do something to remind ourselves of why we do what we do. I think it's an incredible part of self-care. But we're going to find out in a few minutes, that's not the only part of self-care. I think compassion satisfaction is one piece of what we need to look at. I'm watching my time. All right, we'll go through this, and I know we have to take a break in a few minutes. I also would be remiss if I did not talk about the impact of environmental fatigue and environmental stressors. I have been doing self-care for a while and talking about it. And probably about 10 years ago, it hit me that many of the conversations I was having with our alums or our supervisors or other professionals in the community, it really wasn't the client work. They were prepared for compassion fatigue. They had learned about it. They were anticipating it. They were paying attention to it because they had really incorporated that into their skill set. What they were not prepared for was the environment that sometimes we work in and the toll that it would take. So sometimes I'll hear people say, look, I love the work. I just can't be in this. I can't be in this space anymore. The organization has just worn me down. It's the challenge of being in whatever, organizational structure you're in. We need to be prepared to have awareness of when it's the environment, not the client work, but the environment that's really wearing us down. Certainly there's been violence in the workplace. That certainly sometimes is on our mind and thinking about it. Increased workloads, and not often sometimes with increased salary that we get workloads. Some organizations have a very high turnover rate, and that's why I said earlier that I think organizations really need to pay attention to this. Low morale and productivity. We have to see the connection. When someone is dealing with compassion fatigue, environmental fatigue, it is going to impact their ability to be productive. And so that absolutely impacts the bottom line in that organization. It's also when mistakes happen, whether it's in documentation, maybe a decision about an intervention, a missed flag, something not shared, mistakes happen. And in some of the work we do, those mistakes have more cost than we ever want to think about. So certainly that's important. Right now, I think Zoom exhaustion has set in. Environmental fatigue can also add to apathy. You just don't care. Look, I got 5 years left before I retire. Whatever. I'm just going to do my time. Like you're doing a sentence in prison or something. I'm going to do my time. Hearing that apathy of accepting a minimalist kind of attitude about what you do. I also think technology, I mentioned that earlier. I love technology, but it does wear me out sometimes. When it doesn't work the way you want it to, that stress, because I was trained as a social worker, not an IT person. And sometimes the skills I've had to learn to do my job, I never thought I would have to learn how to do. Of course, you know how old I am. You could figure that out from the dates that were given. I can tell you when I went to LSU, we didn't have email. So technology has changed quite a bit for me since I've been in social work. When I first started, I had a phone and I had a filing cabinet that locked. And so our secretary even had one of those little wheels on her desk that she put memos and I can't even think what it's called. Notes. What is that called when they take a message? Oh my goodness. Messages for you. So my life has changed a lot from technology in the work that we do. The last one is lack of a defined work hours and space. I would have talked about this already, even if we would have met 6 months ago. But I do think this has a whole new perspective for us. In fact, I'm going to be interested in seeing post-COVID, which is my new favorite word to say, post-COVID. I don't know when that's going to be, but it's fun saying post-COVID. So I say it as many times as I can because I just wish it and hope it to happen. But I'm going to tell you, I really think that has changed for us too. Many of us are working in home space, sometimes schools there. We have multiple people working in spaces. I think it's hard to know when your office day begins and ends. I think it's all mixed up. We're checking emails when we don't have to. We're getting phone calls and texts when we don't have to. And so used to, there was a natural day and you went home and rested. But because we have the ability to be accessible pretty much 24/7, 7 days a week, I think sometimes we've lost that normal structure of self-care about our day. I think some organizations have expectations you're accessible. And I think for some of us, we've made it ourselves to be accessible. One way or the other. I think some organizations have an unrealistic accessibility to us, and I think sometimes we need to put it down ourselves. I fall into the latter. I need to create a better environment and space for me that I step away from the work that I do. But either way, it has caused environmental fatigue. We all need those natural rest, natural moments when we step away. I'm going to tell you, for the work we do, because it makes us have to think. You got to think about all the risk factors and assessments, thinking ahead, resources. You're constantly thinking about those things. If you're in the healthcare, you're thinking about medication, where they're going to go next, all those things too, that sometimes our mind just needs to rest. We just need to give our mind almost like a muscle. It needs to rest. And I'm going to tell you, I suck at it. I'm not very good at that because I get bored very easily. I have attention issues. I'm bored. But I know my mind needs to rest. You need to rest from someone needing something from you and a problem. Many of you may find yourself, you're the go-to person for problems. And sometimes you need to step away from that role just to catch your breath. And right now, because of technology, it makes us way too easy to continue in that, and we need to step away. I inserted a few things on our slide. It was a Gallup poll in 2018. If you look it up, it has some good information. If you are a supervisor, I encourage you to look at that. It's referenced at the end of the slides today. But for those that deal with environmental fatigue and compassion fatigue, 63% more likely to take a sick day when they're not sick. 63% are going to take a sick day and they are not sick. Although I think every healthy organization has mental health and physical health days. I think sometimes you are physically healthy, but mentally you need to step away. And I think we need to embrace that more in our leave system, that we say it's okay, because when we just say we're sick, we know we're not. We just need a mental health. I think we need to say it to show how much we believe it and support people doing that for themselves. If you are dealing with some of these symptoms, half as likely to discuss how to approach half of them will not even discuss how to approach performance goal with their manager. So they're keeping silent about it too. So when they're feeling compassion fatigue or that environmental fatigue, they don't even ask for help. They're not going to go to someone and say, look, I think I'm in trouble. I think I need some help figuring this out. 23% more likely to visit the ER. And if you're an organization and have medical benefits, you know the cost of that. And so when I said, even if we don't do self-care for the right reasons, we could have financial benefits from making sure that we incorporate self-care in the work we do. 2.6 times more likely to leave a current job. That's that revolving door. And I'm going to tell you, losing historical knowledge of an organization, losing training that you did to someone, that you provided, missing that learning curve that diminishes over time. You can hire a new person, but every time there's a learning curve, there's training. And I'm telling you, we need to invest with the people that we have to keep them more healthy overall, so there's some longevity in the work they do. 13% less confident in their performance. If you're not confident in the work that you do, mistakes sometimes happen. You know, and looking at what we're talking about in regards to that compassion fatigue, the environmental stressors, we really need to look at that. So what do we say to supervisors and administrators to look at? The first thing is, don't overlook the organizational cost of employee burnout. I think organizations should look at it and understand it. If your organization is not tracking that, that means they're not invested in it. I think it is critically important, if you are an administrator, that you have a broad picture of all of these factors that we talked about and the cost. And we're talking financial cost, but we're talking about human cost too in the work we do. Burnout is strongly influenced by how employees are managed. So if you're a supervisor, administrator, we need to spend time learning ourselves. I'm an administrator in the work we have a team. I need to make sure that I am growing as a leader, that I'm making sure I'm doing things to really take care of my team, to keep them at their best, because ultimately the best they are, the best the work they do, and the better it is for me too. And so we need to be invested. I am motivated because I care about my team, which is a huge plus. But even if I didn't, it still doesn't argue the point how important it is for you to do this work. Burnout is preventable. I want you to write that down. I want you to circle it. I do not agree, and research does not show us that burnout is inevitable. Compassion fatigue is inevitable. Environmental fatigue is inevitable. It does not mean that every person in a helping profession will experience that. I think people will experience parts of it. I think we all experience some exhaustion and being tired of helping, but actual burnout that we're going to talk about in a minute is not just something everyone's going to go through. It is something preventable. And I want to encourage you today, as we talk about strategies, it's not because Tracey Lilly said it, but research and evidence practice tells us that we can prevent this. And we want to prevent that. And not just because it's better for the people we serve, it's better for you to be healthy and to have a strong overall well-being. Also, I love that burnout is resolvable. It's resolvable. So just because someone experiences burnout doesn't mean, well, they're done. They're not ever going to work in a helping profession again. That's it. You can remediate that. You can treat it. You can be committed to working with them, but you can't ignore it. You're going to have to be purposeful and intentional in helping that person that truly experiences burnout. If they are truly exhibiting and experiencing that, there's going to have to be an intentional plan to support them to be able to do it. We could spend a couple of hours talking about environmental stress and fatigue. In fact, I do a whole presentation on it. I am so passionate about that because I feel like that, especially being in a university, we have all these students graduating, and sometimes they get into real practice and they're disillusioned by just things that they're seeing and experiencing. And so part of our role as a university is to teach them a little grit, that they have to learn how to exist in some of the realities that are out there. But we also need to equip them to make changes in those organizations, that we need to equip them to go into organizations to create healthier organizations to work in. In fact, I was reading an article last week. There are many organizations in Louisiana, but also across the country, that allow you to bring your pets to work. And so I was just reading about that stress. I do not have pets. I have 2 grand dogs that I love, but I'm always happy when they go home. I think that's my preparation for grandchildren. I will love them too, but I will be happy that I do not take care of them and they can go home. But I'm going to tell you, I think we need to look at every available strategy. I know some through DCFS, through some of the investigations in court, children having to testify, they have animals that come in underneath and sit by that child or that person testifying because they have shown that it gives them calm. It helps them manage their emotions. So I'm going to tell you, if you're a supervisor administrator, we need to look at every opportunity that we can to bring a better work environment to manage that stress. I'll get off my soapbox now and we'll keep going. All right. So we looked at some of the stressors and we've looked at compassion satisfaction. I think we can get through burnout, maybe not. We'll see. I'll give a few minutes and then we'll take a break. We have to look at, now we looked at compassion satisfaction. What is it that we're trying to balance out? You know, we talked about compassion fatigue, but ultimately we're talking about burnout. We want to make sure that we're intentional in creating opportunities to avoid that. So burnout is certainly, it is more than one aspect. It is multidimensional. We know that. It impacts us in a very broad way. It consists, and you see it on the screen, Maslach, Schofele, and Leader talked about it, exhaustion, cynicism, reduced professional efficacy that results in dissatisfaction with the organizational context of the job position. One of the things that their work did in 2001 is they brought burnout and really looked at it within the organizational system. Instead of just looking at it independently, they looked at that person within that organization. And I really do think that research is certainly continuing. There's more research on that because as workers, we exist within that organization and we cannot look with one without the other. So I love how they look at that. Burnout is associated with feeling hopeless, having difficulty in dealing not just with work, but doing it effectively. Sometimes we have difficulty with coworkers. And let me tell you, sometimes it's a gradual onset. In fact, there may be someone in your work environment that you've seen experience this and you kept kind of seeing it, you were worried. There are other times it can happen pretty quickly. It can have a quick onset, but many times we'll see it slowly happen over a period of time. That's the reason we need to know what it is so we recognize it. This is the reason as supervisors and as administrators, when we see it, we don't need to ignore it. Sometimes we can think, oh, well, they'll get over it. It's just a bad day. How many bad days does someone have? We need to recognize it and see it and really address it early on and create opportunities. I think part of it is we got to create safe spaces for someone to walk in to their supervisor and say, you know what, I'm experiencing some symptoms of burnout. Because right now, many people would be scared to go in and share that because they're afraid, am I going to be fired? What are they going to do to me? Well, let me tell you, just because she doesn't say it doesn't mean it doesn't exist. We need to make a safe place that somebody can say that so that you can come up with a plan and a support, because ignoring it is like anything else. It's probably going to get worse. We need to make sure to address it. Some of the signs that you need to pay attention for in yourself, but I'm going to tell you, if you're experiencing burnout, many times you're not going to see it in yourself. The people immediately around you are going to see it before you see it. Unfortunately, by the time we see it, we're probably in a bad situation. We need to pay attention to those accountability people I mentioned earlier. This is when they come into play. Emotional exhaustion, depression, cynicism, unprofessional behavior, comments and in how we present ourselves in the organization, poor performance, decreased self-value, just negative, just maybe sometimes bitter and negative about everything, and poor time management. I do love, you see that last statement on there, is that burnout is viewed from an organizational standpoint and is concerned about the relation and the interaction that person has in that organization. I think that is so critical to the work that we do. So as we're going to take a break in just a minute, I want us to just kind of look at where we are now and kind of where we're going to be heading in our conversations, because we want to move to a place of awareness. We want to move to a place of some strategies that we can incorporate, because you know what? We don't want to have the impact of burnout. We need to recognize some of the warning signs. We need to invest in that building that compassion satisfaction so that we can balance out the two. I'm also going to give you a scale. It's one of the ProQuil scales that we're going to talk about that kind of gives us some information about ourselves so that we can kind of take a snapshot of where we are, what's going on with us. It's a great tool to use with people around you too, and giving them some information about that also. I don't want to move to the next slide because I know we're supposed to take a break. And I'm worried if we won't get through it before we need to take a break. What would you like me to do? I probably need about 10 minutes for the next slide. Can I go ahead and do that and then we'll take a break? Or would you rather now? Yeah, you can. Okay, you good? All right. As long as Robin's not getting people say, please, please, a break. We're good. All right. Good, you can make it. Good. All right. Just a couple of more things kind of pulling it. You know, what are those things that we need to pay attention to? So what are those things helping lead to some of that burnout in some of those environments? And one is just the high stress, okay? High stress in a job does not lead to burnout. And I'm going to tell you, I imagine there are many of you like me that my position and job is very stressful. Just because you have stress does not mean that you're going to have burnout. It's how our organization and how we and the people around us respond to that stress. So, I mean, obviously, every person who has a job is going to feel stressed. I do think some positions just are higher stress. And so for me, I do okay at a high level of stress for a period of time. In fact, I was one of those social workers that really kind of ran to crisis instead of away. I can remember the first time I said out loud to my family, man, I love crisis. And they looked at me like I'd lost my mind. But I say it to a group of social workers and they go, oh yeah, I got you. Because it's not that I like crisis, but there's something about my personality, because I have a little bit of high energy anyway, kind of fits well with that. And so just because you have high stress does not mean you're going to have burnout. But the Gallup report told us there's really 5 pieces of it we need to pay attention to. So rather it's if you're experiencing some levels of secondary trauma, if you've had a lot of vicarious trauma that you've been exposed to, you're beginning to see compassion fatigue, you see those warnings of burnout, you're not feeling that compassion fatigue, there are 5 things that they tell us to look for. One is unreasonable time pressure, okay? We just don't have time enough to get done what is expected, okay? If you just don't have enough to get your time is not enough to do what is being expected of you. You know, it says on the thing, employees who say they have enough time to do their work are 70% less likely to experience burnout. So even though you have a high stress job, if you're given adequate enough time to take care of that high level stress, then you are 70% more unlikely to not experience burnout. Lack of communication and support from your manager, okay? I do see myself for my team. I see me as a buffer between some of the things that are going on above them, that if I can create a buffer for them, not keep them in the dark, not, be some martyr about keeping things from them, but if I can keep some of that noise away from them, it allows them to do their job. And I think it's really important. So sometimes I'll communicate to my team, I know you can feel there's a lot going on right now. We're the university's dealing with some maybe it's financial, whatever it is. I know you feel it, but you know what? This is how it's going to possibly impact us. But on a day-to-day, this is not something we can control. So this is what we're going to do. And so I try to buffer them, but I also try to communicate with them. I try to have transparency in how I share with them, because I want them to know that I'm not playing games, because if I hide things from them, it may create more anxiety for them. And so I want them to know that if there's anything that I know is going to impact them, they're going to know. I'm going to be straight out with them. I'm going to share. They know there's things I can't share with them because of my position, but they know the things that matter. I may not be able to tell them all the detail, but I am going to give them a heads up. I'm going to communicate, because let me tell you, if you're in an environment where communication is not transparent and consistent, you will feel concerned, you feel anxiety, it can build rumors, because if people aren't given information, they make up their own information. Okay. And so we see research shows us how important it is to communicate and feel like not that you're just being told, but that you have an opportunity to participate in communication and give that feedback. The lack of role clarity. Only 60% of workers know what is expected of them. That was in the Gallup poll. That's an alarming number. It really made me think about my own team to say, okay, you know, we sometimes have this, you know, our program when I first started, we had 180 students and it was myself and one other person. Now we have a team of 8 and we have 950 students. My job has changed so much. And so sometimes I have to stop and go, okay, does everyone still know what they're doing? Or has this just changed and been created in this new system that everyone's doing stuff and no one really knows what they're really supposed to do? Making sure that they are clear about their role. Unmanageable workloads. When a workload feels unmanageable, even the most gifted, optimistic, positive employee will feel hopeless. Feeling overwhelmed can quickly lead to burnout. If you can't manage your workload in the work we do, it is going to skyrocket your stress, because you know what? There are serious things happening. If you're a DCFS worker and you're doing evaluation, if you're a nurse in emergency room, if you're doing mental health triage, if you're having suicide calls, whatever it is, if you can't manage that workload, there's going to be a fear in you that you're going to miss something that really causes a significant situation for someone. So that only builds our anxiety. So we really need to do everything we can to find a way to manage those workloads. I know who I'm talking to. I know some of you are sitting there going, I wish you had a line directly to my organization or my boss. I know it. But I'm going to tell you, that's that part of that conversation. Sometimes I think there's a part of us wants to look like everything's normal and we can take care of it. That's why we have to create those safe spaces where you walk in and say, look, I got to be honest with you. I am doing everything I can, but I cannot keep up. And I'm concerned to the risk to them, to you, and this organization. And you have to have some of those conversations. But I do not have a magic wand. I live in reality just like you, but we have to have those conversations. I have a problem of just thinking I can keep adding and adding and doing. But we all have a point we get to that there's only so much of us. There's only so much of that we can do. The last one is unfair treatment. That's a hard one. There's a lot of reasons that people probably are treated differently, rather really being treated differently, or the perception. And I say the perception, not because I don't believe them, but sometimes organizations have this perception of treating differently and you really not understanding what's going on. And it doesn't matter if it's a perception. If that's how you feel, then you still feel treated unfairly. Either that organization can show every which way they don't. If your employees feel that way, it's still impacting them the same way as it relates to burnout. And you have to address that. You see this on here. Employees who feel they are treated unfairly at work are 2.3 times more likely to experience burnout. It also can lead to other things, just unfair situations and relationships in the organization, unfair compensation, and we get into some of these things, and some of it become legal issues that we need to avoid. So when we think about trying to create a healthy environment, there are certainly things, and we're fixing to talk about the stuff we need to do, but we cannot talk about it in isolation without talking about it in environments, because I'm sorry, I'm not self-employed. I work for an organization. So some of my well-being has to do with what I do, but it's also some of the things in my organization that impact me on a daily basis in what we do. Whoop. All right. All right, so let's stop there. We'll take a few minutes breaks. When do we come back? Do you tell them? All right, they're gonna, ooh, look, 3:15, that was on the nose. We will come back at 3:30 and we will finish up. I will see you in a few minutes. Tell me when. All right, we are back. I hope that you got up. I hope you stretched a little bit. That is one of my worst habits that I have developed being at home, is that I do not get up and walk and get out a little bit. So I encourage you. I hope you stretched a little bit. Of course, another problem of Zoom and virtual education is you may be distracted and doing other things already. So I know it's such a balance between them. So we're going to pick up because we really want to think through this part of our time together. I'm also going to do my best to leave at least 5 or 10 minutes at the end if you have questions. But if you do have any questions, Robin is sitting. You cannot see her, but she is right. Well, she is more than socially distanced from me, but she is sitting over at the computer. So if you do have something, please do not worry about asking a question. So one of the things is to look at this point is we want to look at burnout from that practice perspective. We really want to think about what can we do to prevent for ourselves, for the people that we work with, and how to look at it. Because we know that we're impacted in every way. It's not just about being physically exhausted. It's that mentally, spiritually, exhausted in every way. We also want to look at how we as supervisors can work on that. And we want to make sure that we don't ignore the symptoms. So things that we look at is being connected, disconnected, and the impact. And when I say disconnected, we're not just talking about what I mentioned earlier around social media. I think what happens when we're doing work sometimes, when we start having those beginning impacts from secondary trauma, that vicarious trauma, shared trauma, it really does impact us in every way, but it also sometimes it really creates a disconnection. And when we feel disconnected, it impacts us negatively. It's different than stepping back and taking time for self-care than feeling disconnected from people. You know that in the work you do in mental health, when you feel disconnected, it has a lot of negative implications on our overall well-being. So really thinking about what we hear impacts us. So when you say what you hear, that means what you expose yourself. So if you're in an environment and you're working in a situation that you're constantly hearing negative kind of things, it's going to impact us. What we see impacts us, the work we do. What we experience on our own impacts us. So, I told you I do some work with families. And so if I was having struggles with my own 16-year-old, that I didn't feel like I was a very good mother and I was frustrated, then I'm sitting in a room with a caregiver who's having trouble with their 16-year-old. My experience impacts me too, because I'm thinking, how am I going to help you when I don't even know what to do with my own 16-year-old? So it does impact the work we do. Who we are impacts us. As we're looking at working with people with differing abilities and different situations that come from different places, who we are impacts us. I think it's one of the greatest skill that we have in some of the work we do is we can use ourself as part of that tool, but that also means we have to be completely aware of our own well-being before we do that. How we're treated impacts us if we feel valued. I have often told my students, I understand why people enjoy talking to mental health professionals that have been taught those basic attending skills and active listening. Wouldn't you love every day if you had a struggle and you talk to someone and they nod their head, they listen, they're supportive, they encourage you to share more? We certainly know those things are wonderful. We want to be treated well too. It really does impact how we think of ourselves and how we think of others. It does matter how organizations respond and support us. Absolutely. It depends. It matters. And let me tell you, if you're a supervisor or administrator in an organization that's challenged in some way, do not undervalue your part you can play. You may not be able to change the overall agency, but you can change your part of it and the people that you work with. You need to not give up and be apathetic just because the organization has challenges. You can create in your space something differently, and I encourage you to be able to do that. How we take care of each other impacts us, and I'm going to tell you, I think no other time in my adult life have I ever thought that we need to be more invested in paying attention to the people around us, that people are going through hard times? And I think it is very important for us to have a perspective that we do take care of ourselves, but that we also have an external lens. And I'm saying that to people who were talking about self-care and taking and making yourself a priority. But I think sometimes how we do that is stop sometimes just looking at ourselves and how things impact us. I think having a broader view sometimes is about self-care in our situations. Also, how we take care of ourselves impacts other people. You're going to have access to these slides. So some of it is a resource for you. We're not going to talk about it as much, but I want to show you. This is a little bit of something that you can keep for yourself, kind of thinking through some situations. Every once in a while, when you're kind of not feeling like yourself, what's something simple that you can think through? And one of the things that you need to think through, have you had an increase of anxiety or stress due to practice issues? And really thinking through what those have been. Then also looking at, have there been some non-practice? You know, is something going in something else going on with you? Is there environmental issues? So this is a little bit of something to go through, kind of rate your stress. You know, then thinking about, are there some activities or mindfulness things that I can do to address that? Also thinking through the barriers. This seems like a simple little exercise, but I'm going to tell you, these are some of those skills that we need to catch ourselves and to think through, to recognize when things are going on. I think one of our biggest battles about self-care is recognizing that we, not just when we need it, which is important, but that we recognize we need to incorporate it in our lives, in our work on a daily, weekly basis to kind of keep us centered in some way. So this is just a little bit of a tool for you. I talked earlier about that scale, and this kind of brings it out to you. It shows you that professional quality of life. I love having a very high personal quality of life, but I want a professional quality of life too. I don't want to think of my job as something I just have to go to earn a living. My strategy of self-care is purposely saying, I want to have quality of professional life just as much as I do personally, because you know what? They're interrelated. People who say, hey, that's the job, this is my life, I'm sorry. Well, we're not separated and segmented in that way. I think they impact each other. And so I want to make sure that not only do I have a strong personal life, I want to make sure my professional life has a balance in it too. So you see that balance between compassion satisfaction and compassion fatigue. I want you to see it as a balance, because you know what? We cannot eradicate that we're not going to have some issues around compassion fatigue. I'm sorry, the work we do is exhausting. And sometimes it'll get the best of you in situations. You're going to feel that impact from that vicarious trauma or that secondary trauma. You're going to have it, but it's that awareness that we're going to keep it balanced, that we want to make sure that we're looking at those positive aspects of helping. It's the good stuff. And I'm going to tell you, this is their language, okay? The creators of the ProQuil, and we'll talk about that in a minute. They call it the good stuff and the bad stuff. I can understand why they use the bad stuff, because you know what? We see a lot of negative challenges and et cetera. But I'm going to tell you, I think it's human life. I think we all go through crud. Some people a lot more than others. Some people go through more than they should ever have to go, and some people don't. I don't know why we don't have a fairness of experience. I don't know. But I'm going to tell you, sometimes it's that bad stuff that reminds us to live life and appreciate life. It is sometimes being with someone who is suffering with a mental health issue is the reason I appreciate my own mental health. You know, being with someone at end of life appreciates life, and for me not to waste it. So sometimes that bad stuff is our perspective for the good stuff. So that's the only reason I say that. I think it gives us context and perspective. But I love this image that they shared, is that we are balancing those things. At days, our weight is going to be from being fatigued from the work we do. Other times, our satisfaction is going to be really high. And if we are healthy, if we're doing this in a way we need to, we're going to see it constantly doing this. That it's always trying to find balance. It's probably not going to be often 50-50, but it should be constantly wavering back and forth. If your compassion fatigue is always outweighing your compassion satisfaction, that's when those risks happen. The risk to you feeling the effects of burnout, impacting the work you do, impacting the organizations and the work you do. And I think we need to be really thoughtful of that. This is a little bit of the model, looking at that compassion satisfaction and compassion fatigue, really looking at the balance in a different way. So on one side, you have compassion satisfaction, but the other side, you have compassion fatigue. And when they get imbalanced, that's when burnout and secondary trauma, the impacts of that happen. This is just a slide that I saw. And the reason, I'm going to be really honest, the reason I like it, it talks about work environment, client work, and personal. I think all three of those things go into play in really managing how we're doing our work, our personal life, and how we do it, and also the clients that we work with. It's that environment, it's that direct practice, and then it's life in general for us. And you see how complicated that can get and how important it is to balance it. The other thing I want to share with you, and this is something that I'm going to ask for you to do after we are done, and a time when you can pull it up. In fact, we will have an opportunity at the end for you to go and jump on and hopefully do that. But it is the professional quality of life. It is an evidence-based tool that I think is very easy to use. I encourage you to use it with your team members. I encourage you to use it for yourself. You can use it for groups in your organization. There's a very simple one you can do. There's also a more detailed one, but this link will bring you to it. Even if you want to just search, if you search professional quality of life, simple scoring, it's going to bring you directly to that page too. What it does is it asks questions. In fact, you can't see this because the camera is so far away, but it's a very simple 30-question scale that you're going to be exposed to. And it asks you, it's a Likert scale, very easy to fill out, but it looks on a couple of different constructs, and it looks about compassion satisfaction, but it looks at compassion satisfaction in relationship to burnout and secondary trauma, okay? So it looks how you're doing. I'm going to tell you, I've done several of these trainings about this over the last, I guess we started in June, and I've done about 9. And I have always gotten emails later. And someone said, you know what, man, I took that test. It was so encouraging because I really feel like I'm doing great. But I also got more emails that said, you know what, I came to your training because a lot of people I know, our supervisors come because they know me. Some people came because of the topic, whatever it would be. And they said, listen, I got to be honest with you. My score shocked me. I am actually in a concerning area. I am not at burnout, but my numbers are in that mid-range that tells me, you know, I kind of knew it, but I kind of was ignoring it. And thank you for sharing that tool with me, because I'm telling you, I need to take care of business, because actually I've been a little bit more stressed than I thought. This has impacted me. I think I felt a little bit more hopeless than I thought. And my compassion satisfaction is not nearly what I want it to be. And I think that's impacting the work I do. It has been around for a while. I get no benefit whatsoever from this scale. I don't know the authors of it. I have no benefit whatsoever, although I can tell you, I'm so grateful that they share it so freely that you can use it to really identify. It is not, and I'm going to tell you what it's not. Okay, one, it is free. It's 30 items on it. And I told you those 2 subscales that it's looking in, but it is easy to use. It can be done individually or in groups. It can be done online, or you can be done on a piece of paper. The full scoring is one of the things you can do for your organization. I use the simplified scoring. I do it with other people. I encourage you to do it. It is easy to find, and it is easy to use. It's also good for training situations. If you're a supervisor, if you're an administrator, and you want to, hey, say, look, let's do this test, kind of get an idea, then let's come together, come up with some ideas, how we can do some self-care together. I think it's a great place to get an idea of where you are. One of the things that we teach in my class that I heard as a social worker, and many of you have, you start where the client is. And to me, this is a good place to get an idea Some of us know exactly where we are, and some of us, when we fill out something like this, it gives us that information. It is not a medical test, okay? It is an evidence-based assessment tool. The purpose of it is not to be a psychological test or a medical test, but it is to give us kind of a basic screening, kind of an overall view of where we fall in regards to compassion satisfaction, compassion fatigue, burnout, and also how the secondary trauma has impacted us. When you're interpreting the scores, it does take about 15, 20 minutes to do. And I'm going to tell you, the score is going to help you decide where you need to go in your self-care plan. And we'll talk a little bit more about that in a few minutes. The one thing I like it is it helps us develop a plan. And I love assessment tools just because I think sometimes when we're just verbally talking about it or our own awareness, we can downplay things that are impacting us. But I think sometimes when we answer questions, it gets at the heart of it. It gives us a true picture of what's going on. And I think as social workers and other health professionals that use scientific data to look at stuff, that we have an appreciation when it can do that. So I love that it's individual and it looks at me, but I also love that it can help you organizationally. If you're a leader, a supervisor, rather a supervisor for work or for licensure or credentialing in your area of practice, I think it can really add to discussions. I do this with our young beginning social workers that I'm doing supervision for, because I want them early on to develop self-care as an intentional tool that they need to be aware of. So, and I also, when we think about the work we do, it's realizing, I mentioned earlier that you use yourself. You know, even today, I'm not with clients, but I'm going to give you everything I have for this 3 hours. I absolutely value continuing education. I value every time I'm in front of students. Anytime you have a chance to influence someone else, I think it is significant. And so it can be exhausting bringing yourself into those situations, and especially if you have a history very much for some of the experiences that our own clients have. If you've experienced some difficult situations, if you have trauma in your past that you need to, I tell our students all the time, if you have experienced something, maybe sexual assault, you need to be prepared for that question, because clients are going to ask you. If you're leading a suicide survivor group, someone's going to ask you if you've experienced it. If you're doing substance abuse, someone's going to ask you that question. You need to be prepared of how you're going to respond to it. But I also think you need to be prepared how you're going to manage your own self-care while working with people who have similar situations. We also have our own challenges in life. You know, we may be dealing with financial issues, and then we go into our organizations to provide services for people that are doing that. And so we need to be aware of how that impacts us. We also bring our past and our present into everything we do. You know, when you're in a helping profession, that's part of it. We are part of what we do. And so as much as I want to say I leave everything outside when I walk in with a client, which I hope I do, it's not as easy as that sometimes. And I think it's self-care that helps bring some of that separation and our ability to shift our focus in the work we do. And we'll talk about that a little bit. So what is self-care? You're going, great, we have less than an hour left, and she just said, what is self-care? I'm going to tell you, everything we talked about before this moment is so important for you to understand what self-care. When I first ask students this in my class, I hear things like, oh man, it's when I go get a pedicure. Man, it's when I jog or I exercise. And sometimes they can think activities are self-care. That's not what we're talking about today, although overall self-care is going to have maybe some of those activities that bring relaxation, help you feel rest, kind of renew your spirit, whatever it is. But those are activities. Self-care is an attitude and an awareness that you're in a profession that you have to be fed to, that you need something to help you keep balance. You need something to give you perspective. You need something that gives back to you in some way. The old saying about you need to fill your own cup, I think that's very true in what we do. So the definition that's been given from lots of different people a lot smarter than me, the practice of self-care refers to the purposeful actions people and organizations take that contribute to wellness and stress reduction. So I want you to pay attention to the first word, purposeful. It is purposeful and it's an action. It can't be just knowledge. If you leave today and you know more, that's great. But if you're not going to be able to apply this in some areas, it's not going to be helpful. You don't have to just know it. We have to do things actively and purposely to be able to do it. And I also love that their organization doesn't just say people, but it says organizations. I truly believe for us to have the healthiest healthcare, mental health workforce we can have, we have got to have great self-care. And I think organizations have to be a part of that. Positive increases in self-care, self-awareness, and age are related to decreasing our symptoms around secondary trauma. We also know that increase in positive coping styles will increase our compassion satisfaction, and it's going to decrease our chance of compassion fatigue. So I want you, in your mind, when you think of self-care, what does that mean to you? Self-care, for me, is putting a very purposeful attitude that I have got to take care of myself too. I hate to use that reality of the whole on the plane when the oxygen drops, you have to give yourself oxygen before the person next to you. But I'm going to tell you, this is where self-care comes in. If you don't take care of yourself, you will have nothing that you can give to someone else, or what you're giving is not as effective or helpful that you won't. There's also ethical implications to the work we do. When we become, when we have fatigue, when we're burned out, we can become biased and very judgmental. We can be impaired in our own work. Not only negligence, but purposeful. We can purposely do things that can harm or not be as effective. Our boundaries become a little bit blurry sometimes. Inability to be effective, not enjoying our job. We feel like we're making minimal impact, and professionally and collegially, I'm going to tell you, sometimes we don't enjoy those people that we're working with when they're not doing self-care. I love this quote by Anna Baranowski, as I think her name. It is not the absence of compassion that creates problems in our work. It is what compassion is replaced with in its absence. So when we have compassion fatigue and we're not able to have compassion, something comes out. And that's the concern. Is it hopelessness? Is it bitterness? Is it jadedness? Something else will replace what we do. So we're going to have some strategies. And so we want to come up with some suggestions and a plan of how we're going to address some of the things we talked about. The first thing is, it is a personal matter in how you do it. Self-care is not a one-size-fits-all mentality. You need to know yourself. Some people who are more introverted maybe need time alone. They may need quiet. They may need just no distractions. They may take a breath. Maybe they want to read books. And it's not about reading the books. It's the activity they need to calm themselves and put them in that place. For me, I am in my kitchen and I'm cooking for 20 people. I'm not thinking about anything bad. I'm not taking care of anyone's emotional needs. I am just cooking and feeding my people. They're sitting at a table playing games. They're outside with the dogs. That is my self-care place. Now, some people would say to go in the kitchen and cook for 20 people would stress you out. For me to go down in the bedroom and read a big book for 2 hours by myself would stress me out. You need to know what gives you joy and what makes you feel complete, what gives you energy, what gives you calmness. You need to pick what you know is helpful for you. Absolutely different aspects for different people of self-care. So examples that people have found useful, one in the workplace or professional, that you have found a way in your workplace to really incorporate self-care. Rather, that's taken 15 minutes to kind of have joking with the people around you. Maybe it's stepping away from your desk and walking. It may be sitting for a few minutes just meditating. So I know some people walk around their office building. What does it look like in your workplace that you can step away? I want you also to think about physical, psychological, emotional, spiritual, and relationships. You know, all those areas can take from us, but how do we look at ways to self-care in that way? Sophia Jingaliski, I don't know if you've ever had an opportunity to hear her. She is a speaker in social work. She's a social worker, I think out of Florida right now. But I went to a conference with her about 10 years ago, and she does a lot on pharmacology and talking about such an important piece. I mean, pharmacology is such an incredible piece of healthcare, mental health, everything, because there are many times that we need some type of medicine to be the intervention of medicine to make things better. But she said so often we forget the three basic things of sleep, diet, and exercise, that those things are as important of us having that well-balanced well-being that we have. And I'm going to tell you, being at home, being on Zoom, I will sometimes do this for 3 or 4 hours and forget to get up, to where when I was in the office setting, I probably got up and went down the hall to do something, or I had a coworker come in to take a break. But I have forgotten some of those natural pauses during my workday, and I encourage you to be able to do that too. But when you think of self-care, it has to include all those areas. You need to develop a plan that is going to manage stress and anxiety. Okay, those are the two biggest culprits that we have in impacting us. And so one of the first things to think about is including all the areas we talked about, but also being realistic at your style, what means something to you. I also encourage you to take small steps. Some of you are already really good at self-care. All this conversation to you has just reaffirmed to you how important you already are doing it. Some of you may be a little bit like me in that video I showed you at the very beginning, that you say, yes, I need to rest. I'm not going to do anything. Well, let me just do that one email. Oh, you know what? I'm just going to do that. Look, it won't take me long. I'm going to knock this out, because my biggest excuse used to be, and I'm going to be honest with you, it's just been probably the last few months I've really been trying to work on this, is I would say, you know what, I'm just checking my email at 8 o'clock at night because I don't want to wake up and have all those emails in the morning. So I'm doing it to reduce my stress in the morning. Well, I'm going to tell you, for me, that was just an excuse. You know, that was an excuse, and maybe it did help me in the morning, but it didn't give me downtime. It didn't help me step away. And so because sometimes now our work is so close to us at home, we go, oh, just a few more minutes, this or that. And I'm telling you, that's the reason those small steps are important. So now I have to shut the door to my office. I have to shut the door as a physical barrier reminder not to go in. So in fact, something happened last night that I had to take care of at 7 o'clock. And I looked at my husband, I said, look, this is what's happening. I need to go work for about 10 minutes and I'm going to be right back. I was very cognizant that I was choosing to it. We're used to, I'd have just done it and not really thought much about it. And so take those small steps. Just like with clients, sometimes the change doesn't happen, 0 to 100. We're going to have to incorporate those things that really are helpful for us. I also encourage you to make it practical. We also want more bang for our buck. Just like with clients when we're doing treatment plan. So for me, cooking and being with my family helps me spiritually, mentally, emotionally. It gets me away from work. So that one activity gives me so much in so many ways. And let me tell you, my family loves for me to cook for them, so I don't have to beg them to come. I may have to beg them to do other things, but they are happy to get a free meal. When you have adult children, they love free food. And so I'm just telling you, if you can do something that gives you multiple areas of your life, it pulls me away from work. It pulls me about things that bring me joy. It reminds me what's so important to me. My family is my number one priority, so it kind of recenters me a little bit. And so I'm just going to tell you, but for some of you, it may be getting on a motorcycle, which I can't imagine, but I know some people do, and go and ride and just get away. So you need to make it practical, and you need to make it be something that really speaks to you. I also think, you need to know what your barriers are. My biggest barrier is my attention. I get bored very easily, and I am also someone who enjoys work. And you would think that is a good thing, but when you're talking about self-care, it's not always a good thing, because just because you enjoy something doesn't mean you should have it nonstop. So even though I enjoy my work, I need a break from it. Okay. And so we want to make sure that we recognize barriers and what they are, which leads me to one of the next step. And it's about an accountability partner. Your accountability partner better be someone that you respect too, that's going to speak into you and you're going to listen to them. I need someone to say, I'm worried about you. You're looking tired. You don't sound like yourself. I'm seeing some physical exhaustion, but I also, you've seemed so negative, and I am not a normally negative person. I am one of those annoying, glass overflowing kind of people. And so I say annoying because I work with some people that are more kind of a half glass kind of person. I have a coworker, she says she's a barely any in her glass person. And so between the two of us, we make a whole glass. But I'm going to tell you, you need someone who can kind of look at you and say, look, I'm concerned about you. This is what I'm hearing. This is what I'm seeing. I'm here if you need me. I want you to, at 5 o'clock, I don't want you checking email. I want you to step away from the work you're doing. You need an accountability partner. I also think sometimes, even though we don't like it, you have to reevaluate your fit in the specific agency setting or the work setting you're in. I think some of us find ourselves in work that doesn't fit us. Sometimes our work can kind of highlight our negatives instead of our strengths. And we want to make sure that our work environment is a good fit in the work you do. I started off working with kids and I loved working with kids, but I can tell you that wouldn't be a good fit for me now. I would probably work with older adults now. And if you'd have asked me 30 years ago, that would have been the area I didn't want to work with. So our interest and our fit even changes as we grow. So when you think about a self-care plan, you want to make sure that your work is a good fit for you. I had to step away from working with women who had been assaulted and had sexual abuse because I had 2 young girls and I could tell it was impacting me. So I had to step away for my own self-care. So I encourage you for that too. I also think understanding that we have the reality that we have limited control over some of the environments that we work in, but we do have total control over our response to it, how we let it impact us, how it gets the best of us. Please know when I say that, it is so much easier said than living with, and I get it. I tell our students all the time, I think we need to participate in organizations to try to change the things that create negative situations for us or clients. We need to be a part of that change at that agency. But I also am realistic to know that sometimes no matter what we do, we can't change the agency. That is the reason I encourage you, then you need to change your agency. Because if you are in an environment and you've tried and tried to change it, if you don't change your environment, it will begin to change you. And you'll find that apathy and that toxicity that you don't want. And I know that's probably not a welcome comment for a lot of people, but I do think that if you're in an environment that does not support you, that really brings all these negative things, if you don't address it, I'm going to tell you, it will begin to impact you negatively. I also think another step is really mindfulness. I know that mindfulness has been a huge part of practice for a long time. It has definitely had a resurgence and a rebirth. I think the millennial generation kind of grabbed hold of it and it's become really much more popular. But I think that mindfulness, we've always known in the work that we do for self-care, is that we need those mindful moments. We need to be aware that we're controlling our thoughts. And that's what I think of mindfulness, is that we're very aware of what our thoughts and how it's impacting us. And that mindfulness of being able to aware of our breathing, aware of the tension in our bodies. One of our students did chair yoga with us not long ago. And she, had us doing stuff. And I was doing it with the students because I wanted them to see me participating. But the first time I kind of half listened. Well, the second time I listened to it, and let me tell you, It's amazing when you really start paying attention and you feel that stress. And I checked my blood pressure after and it was so low. I'm going to tell you, being aware of your thought process, your breathing, your body, your tension, all of those things can make a big difference. I also think the single focusing, really kind of blocking things out and letting your mind just process one thing, kind of slows down that for you. And also the social supports that we get, attention to those things that sometimes we miss because we're kind of hurried in everything, and really mindfulness at work, that we take those things in, which builds acceptance, flexibility, and non-judgmental. The number 9 to me is important. I think sometimes we get so routine in the work we do, we miss the things that we do well. I think sometimes we miss the impact because, you know, I as a social worker, my husband was in education, but one of our best friends is a pharmaceutical rep. And we always laugh because she wins like a trip to go here and she gets this. It's, you know, kind of that competitive, but they give a lot of recognition for things that you do. Of course, I know they have money too. Education usually doesn't. But I'm going to tell you, we don't have a lot of that. So we really do have to find those spots to be mindful of when we do hit things just right, when we do make a difference, because we are surrounded a lot of negative, and I think we need to have mindfulness at times to take those wins and those successes, and when we see those differences, I think we need to remember it and pay attention. This was just one thing I wanted to share with you. It was a little pocket card that you can print. In fact, the references for you to do that. And it just kind of encourages you then when you're having a difficult day, something's going on, but it also focuses on empathy, which I think is a huge part of what we do. I love that other is how to become better at switching between work and off work modes. You know, how do you kind of come down from an intense day? How do you let yourself be in that off switch? And I love the first one, make it a conscious process. Talk to yourself about it as you switch, using images, developing rituals, breathing slowly. Mine is traveling home. Mine is in my car. I think about when I get home, I think about my day. And at some point, when I go over the Amite River Bridge, I'm like, okay, I'm done. Let me think about other stuff going in my life. I really kind of just use that as that ritual to shut down everything and focus on my personal life. This also, I like this card. This is something you can use with clients. I think it's a very helpful tool. I love it because it looks at every aspect: physical, psychological, emotional, spiritual, personal, and professional, really looking at those dimensions of really living through, especially when we've had trauma and we've had situations happen. I think it's such an incredibly impactful tool to use. So it is for a tool for you. All right. So I want to talk about a few things. I want to see first if we have some questions. Do you have some questions for me? And then I will see how much time that we have. Did you have any questions? Because I don't want to get too off topic on what I was going to do. Because I'm going to need y'all to tell me a few things in a few minutes. I'm going to need you to chat with Robin and give her some feedback in just a few seconds. Do we have any questions? The last card, I can give you the name of it. And also, when are they going to have access to the slides? Do you know when they'll have access to the slides? Next week, but let me give it to you now. It is, if you go to www.olgaphoenix, is OLGAPHOENIX.com. In fact, I could have picked that up. I don't know if I've shut it down. Oh, I did. I shut it down completely. I'm sorry. I shut it down. If you can give that slide to look at it. Do we have any other questions before I move on? All right. So you got one? All right. So let's talk about, with the time that we have left, I really want us to take what we know, and I want us to think path forward. So I want you to think about one of the barriers Okay. So since we're not in person, you're going to have to chat it to Robin, because I want us to have a little opportunity before I talk about the ending, about kind of creating this plan. I want to hear from you about, what do you think the biggest barrier is right now for you, or maybe you've noticed it in other people in the helping profession. What is the biggest barrier right now for managing effectively self-care? Tell us what that is. And I think I've left enough time. I'm going to try to get through the rest. I'm sorry I delayed a little bit, but I'm going to keep us on track. And I can't see anything because I don't have my glasses on. So I can see a monitor a little bit, but I cannot read it. And I thought there was only 30 of you, and I found out there is a lot more than 30 of you. So we should have a lot of words. So Robin, call out some words for us. Isolation.
Changes that are unexpected and ongoing.
Changes. Constant.
Too many responsibilities, not enough time.
Too many responsibilities, not enough time.
Continual shift changes.
Continual shift changes.
No one to socialize with.
Lack of socialization, feeling disconnected right now.
Working from home and no separation between.
Turn your microphone on? I'm going to have Robin kind of tell you, because I know y'all can see it, but I want us for a work.
Boundaries, not prioritizing, working from home, which would serve as my space away from work, too high expectations, too much work for the allotted time. These are some of the ones I said earlier. Isolation due to COVID, my own distraction, COVID issues with work and home, constant changes, continual shift changes, no one to socialize with, so many unknowns, increase of clients and lack of staff.
Has anyone felt a little self-care around Zoom exhaustion, telehealth? Has anybody been feeling some of that from telehealth? You can ask. Yes. All right. I've heard that a lot recently. So what I want to do, I know we only have about 25 minutes left, but I want us to spend some time taking some of these things, because I think talking about it today, one of my first parts of this, and that's one of the challenges of not being in person, this is when you're going to do a plan. This is when I want you also, it will take you about 15 or 20 minutes, and I know that'll be a little bit more than the 3 hours that you did, but I want you to take the Procol too. In fact, I'll try to finish it, give you about 5 minutes to do that. But I want to tell you, this is when we really get to the intentionality. The reason I am so committed to self-care, and I told you early on, I am certainly not a poster child for good self-care. Certainly, probably in evidenced in many ways. But I'm going to tell you, I've seen it so firsthand in some incredibly gifted workers, incredible healthcare workers, incredible LPCs, social workers, wherever your background is from. But it just becomes too much sometimes. And I don't think it's because they don't want to do the work. And so that is the reason I am so passionate about it, because it is something preventable. It is something that we can work through. And so it's always sad to me as a professional social worker when I see people leave a profession that they're extremely talented in because of issues that we could prevent. So let me tell you, I appreciate for the people who shared some of that feedback. I am not surprised at what you said. In fact, you probably heard in the earlier discussion of it, you heard some of these issues being talked about. So let's talk about some purposeful and intentionality. And we have to look at it. Remember, we talked about, we're going to look at it personally within organizationally. And so I use myself because I'm going to tell you, I am very passionate about it, but I know just because you know doesn't mean you do. And I do think in social work sometimes, in helping professions, many times, those that do it for other people do not do it for yourself. I think many of you are not shocked about our conversation today. I doubt there is anything that I said today that was shocking to you, or you went, wow, I didn't know that. Man, this is, this has changed my life. I don't think that I have that much knowledge to give you today. But I am going to tell you, sometimes it makes us stop to hear it. I think it makes us stop to think about it. And so what do we do at this point? The first thing I'm going to tell you is I want you to take Proquil. You may have another assessment tool that you find that you want to find some information about your own burnout or compassion fatigue. I'm sure there are more scales out there. This one's just been around a long time, and so it has a lot of reliability and validity. But I want you to become aware. I want you to think about those terms that we talked about at the very beginning when we talked about shared trauma, because let me tell you, we're there. I don't know how many of you are from Southwest Louisiana or up the corridor up to North Louisiana that the path of the hurricane hit, but you are having a shared trauma right now. And not only are many of you having to take care of yourselves, you're also having to think about the clients that you serve. How do you still meet their needs when your community is in such a difficult time? I'm going to tell you, I live in Watson, I told you, and so we were one of the 5% that didn't flood during 2016, and we were incredibly blessed. But I'm going to tell you, we had about many people living with us during that time and trying to really help other people. But I'm going to tell you, I saw so many workers, healthcare workers, social workers, mental health professionals who left disaster in their home and went into spaces to provide services. And so we know if you're in some of those areas, as we're all over the state today, that we know that you're providing services as well as having to manage your own well-being. So I'm going to talk to you first. If you have shared trauma, you have got to recognize that for yourself. You have to recognize how things are impacting you. That doesn't mean that you can't do your job effectively, but you need to know that it's impacting you. If you're listening to someone fearful of being able to pay their larger deductible because it was a named storm, and you yourself have dealt with that, you need to get support. So how do you do that? Some of you are going to have coworkers that can be your support, that you can talk to them, process with them. They're going to encourage you, and that's going to meet your need. Some of you have people in the community. Maybe you have a faith-based community, maybe a social organization, a group of people that you get together and you share with, you support each other, you share resources when they're available to do it. But just like our clients, sometimes it's not going to naturally happen. Sometimes you're going to need to seek out professional support. And I'm going to tell you, professional healthcare workers, professional mental health people are not always as open to get support as you think they would be. Many times we think that we don't need that type of help. And I'm going to tell you, around self-care, one of the barriers that is there is for us thinking that we're above the reach of mental illness or life circumstances, that we may not need professional help. I have seen a lot of change in the stigma about mental health in my years of practice, although it is still there, but it is nothing like when I first started social work practice. But the one area I still see us struggling in is about our own mental health and our own struggles, for us to really talk about that with people. And I want to encourage you today, if you find yourself in those spaces of some shared trauma or something in your own situation, Self-care and your strategies are not going to be successful if you do not seek out that support for yourself, whatever it would be. If it's individual, if it's a support group, a crisis line, a chat room, which I know that we have a lot of mental health chats, whatever it would be helpful. I often tell my husband, I know too many mental health professionals in the state. If and when I do have my mental breakdown, he's going to have to take me out of state for me not to have a dual relationship. But you know what? We laugh about it, but he knows if I need that help, I want him to go and get me that help, because I have such respect for the work we do on a daily basis. I believe in mental health. I know the difference that it makes. I see it, but sometimes we don't do that for ourselves. So I'm telling you right now, for each one of you, when we first talk about a barrier, that we need to seek out supports that we need. The next part of your plan is maybe you don't see yourself needing to seek out support. It may be that your organization is your stressor. And that's where some of the things you said were there. There's just unrealistic expectations. It's too much to do. There's constant changes. Some of you talked about shift changes. You know, I want part of your self-care plan is to be able to go and talk to your supervisor. I know that some of you are thinking, she doesn't know my supervisor, that's not going to help. And you know what? It might not. But you need the activity of trying, because you don't know what you know till you know. The answer is no until you ask the question. And so I encourage you, because my own team, sometimes I'll see them struggling. I'm like, what's going on? Well, and they'll tell me, I'm like, why didn't you come tell me? We can change some stuff. We can do this. Well, and I realize it's not about me. So I have to take me out of it being defensive and say, you know what? It's about them. They thought they were going to look weak, or they look like they couldn't do their job. And I then have to be in that space that I talk about so often. And I look at them and say, you know what? You can do this, but we need to take a break. You need to step away for a little while. Let us take the slack up for you while this is going on. Everybody has an opportunity where they're taking slack up for each other. And this is where you are right now. And it is okay. So I have to normalize it. I have to support it. So the next time that happens, maybe they'll come to me before. But the reality is, I know for some of you, you're going to say that and it's not going to matter. The organization or the administrator or supervisor, whoever, they may not be able to have that conversation with you, either because the organization doesn't have the supports, or because their leadership style is pretty much, well, you're lucky to be here. You know, it's our way or the highway, whatever. I do think sometimes organizations feel like we should be very grateful to have a job there and kind of go from that mentality. Although I am very grateful to have a job right now when so many people, but I still think it is fair when you think of self-care that you speak up when things are going on with you. When you start recognizing that compassion fatigue, being just overwhelmed with your workload, that you're concerned that you're going to make a mistake, that it's going to impact you, going to impact that organization, you have to have the conversation. So your self-care plan has to start there. It has to start of what can I do within this organization to address my concerns? But the first thing you need to know is what they are. So very much like I asked you today, you need to go through. If you take the ProQuil, it'll tell you a little bit, but you need to go through and say specifically, some of you shared it when Robin was talking, it's the shift changes, it's the constant changes. Right now, I feel like every time we get a plan, we're on about plan Z. You know, we started off with plan A and went to plan B, and we just keep on. And, you know, I think we're getting into the double letter of plans right now because things change so much. And some of that no one can control. But you know what? Some things we can. And I want you to take an opportunity to give your organization an opportunity to support you. You can only know if it's safe to do that. I don't. But I'm going to tell you, if you're not in an organization that you can at least have a conversation with someone about your concerns of what you need to self-care, you really need to think about your organization. You know, it may be that someone comes to me and I say, look, there's nothing I can do about it right now. It is what it is. In fact, I have a t-shirt that says it is what it is. And I hate that saying, but sometimes right now it is what it is. And we have to do the best we can in that situation. But I can say, look, if you can hang on with me, this is where we're headed. You know, if you can get through the next couple of weeks, we will look at this. Sometimes we have to be realistic, but I want you to be in an organization. I want you to be a supervisor. I want you to be an administrator that can have these tough conversations because they are foundational to self-care. We have to be able to have those conversations. Remember burnout? The researcher said it is the person within the fit with that organization. We cannot ignore the impact that that has on our overall well-being. So what's the next step in our self-care? The next step in our self-care, we've talked about we may need some professional help. We've talked about looking at organizational. The next thing is us. The hardest one, the toughest one. One, some of us have really bad habits. We have really bad habits. And let me tell you, this sounds very counterintuitive, but I'm going to tell you, competence is often rewarded with more work. Competency is often rewarded with more work. So you do great at your job and you work and you stay late, and often it is seen as a very positive. In fact, people say positive things to you because of it. And it reinforces sometimes you not taking care of yourself because you want to be that person that does everything and does it well, which I myself can completely appreciate. But we can develop some bad habits about that personally and also from a supervisory place. You know, I remember a while back, I saw a supervisor that I just love, and she had hired one of our new graduates, and she's like, man, they are amazing. You know, she is like, man, she is there in the morning. When I get there, she's there when I leave. Man, she's just working, doing such a great job. And I said, I'm so glad to hear our alums doing so great, but do you want to keep them? Well, yeah. I said, well, I'll tell you this. You better start making sure they leave and go home, because that person that's there when you get there and there when you leave eventually is going to burn out. You need to make sure that you are taking care of them and supporting them. So some of us, it's not the organization, and we don't need maybe some professional intervention, but we need some personal intervention. So when you look at yourself and you evaluate where you are, I want you to take stock for yourself. So the first thing I want you to look at is, do you have a clear boundary between work and your life? Are there clear moments that you step away from work and you engage in life? Are there times in your job that it is crazy, but you still shut that door, you still leave that office, you still turn that computer off, you don't check that email, you step away? The other thing is, are you really staying aware of how the work we do impacts us? You know, do you let yourself recognize that it's heavy? Do you recognize that it's sad? That sometimes we see evilness, and I don't use that word lightly, but I'm telling you, I have seen some evil and horrific things that people have done to each other. You know, do we allow ourselves to recognize that that's happening, and that we say, whew, I need to get some fresh air. I need to watch a comedy that only makes me laugh. I need to go cut grass and see that I'm accomplishing something. I'm going to go crochet something, paint a piece of furniture. It's not about what you choose. It's about you stepping away and letting your mind absorb something that's positive. When I was at Women's Hospital, I shared with you my situation as an intern, but I remember one day Susan Eaton making me go to what was called the Well Baby Nursery then and just hold babies. Just hold babies. Because my whole experience had been in ICU. Babies were sick. Everybody was sick. But you know what she taught me that I'm telling you now, 32 years later, is that she taught me that at Women's Hospital at that time, 92% of all babies went through Well Baby. But 8% of my clients went through NICU. I mean, 100% of my clients went through NICU, but only 8% really did. But because I worked with that, 100% of my focus was on the negative and problems and families in crisis. I had to remember there was a whole population out there that were having a joyous experience. And when it comes to taking your personal self-care, I am telling you that is at the heart of it, is that you realize that your profession, whatever setting you're in, 100% of your energy is focusing on that one problem. But there's a lot of good, a lot of positive things that are happening, but we sometimes don't see it if we don't look at it. You need to find those spaces that gives your mind, body, and spirit a way to get away from the negative. The other part is you have to intentionally choose things that give you joy, that make you feel encouraged, that give back to you. So that when we talked about midway, when we talked about compassion, satisfaction, that is where we land. You need a plan. You need to intentionally address what you identify as some challenges for you. You need to intentionally, if you find yourself high risk for compassion fatigue, high risk for burnout, you need to actively encourage yourself to sit down and come up with a plan to address it. You have to intentionally do it. If you don't, it's going to get worse. But let me tell you, the positive today for me is if we incorporate self-care intentionally and purposely, we know ourselves, we get the supports we need, we take advantage of those successes that we take. I learned in mental health that I had to take a success with someone actually voluntarily going into the hospital instead of having a PEC. You know, sometimes what we see as successful has to be determined by the work we do. But you have got to get your compassion satisfaction higher so that you can manage your compassion fatigue. Okay? I think they're telling me I need to stop. Oh, no. Okay, I'm good. I'm sorry. I'm listening to the room because I am nosy. But that is where we land today, is we have got to make sure that we feed compassion, satisfaction. So you know what? You may have to volunteer and do something that has nothing to do with social work that just gives you joy. You know, you may want to go to the animal shelter if you love animals and be the one who bathes and loves on them until they get adopted. You know, you may want to go work in the nursery at a faith-based and rock those babies on whatever day that they have services. You need to find something that also gives you joy. You need to do it purposely because you have to be reminded of that. Sometimes this work has a way of pulling us in a way that it kind of, we talked about vicarious trauma, it can shift our world focus and be a negative. I'm going to tell you, that's me watching social media right now. If I let myself get caught up in social media, it impacts my attitude, my words, everything, because it's so much negativity. You know what? I learned I don't have to go on social media. I have a choice if I do it. So when you think of your own self-care, you need to make sure those things that are taken, you need to do your best to step away from it and replace it with something. So you know what? I have replaced social media and putting my phone down and going to sit in my swing and sitting there. And guess what? I have neighbors who come and social distance at the swing across from me that I usually don't talk to or take time to because I put social media down. So not only is it not negatively impacting me anymore, I'm engaging with people in a time many of you put isolation and disconnected. Now, I got to tell you, because they know I'm a social worker, sometimes it can come a free social work session. So I have to make sure that I don't become their free counselor. But I'm going to tell you, intentionally, purposely choosing things to feed positivity, encouragement for yourself, and self-care. You are worth it. You are worth doing what you need to do to take care of yourselves. I want you to be in organizations that join us in making sure that we prioritize that. We know it takes grit to do the work we do. I mean, it does. It takes grit. You got to have some mental health and self-awareness, but you know what? We have to add to it and help it. So I encourage you today. You know, I don't know what you were hoping for today. I don't know if you got what you needed, but if nothing else today, I hope that you had a few minutes to say, how am I doing? What do I need? You know what? I need to take better care of myself. If that is what you leave with today, then I feel like we have been successful. Because let me tell you, mental health is worth taking time to take care of. It is worth taking time to have that because it impacts every aspect of our life. So I want you to be well. I want you to be effective. I want you to do great work. But overall, I want you to have satisfaction in the work you do so that you can continue doing it. I know it takes a long time for 3 hours to sit here and watch a computer or listen. I thank my people in the room with me that have hung out with me for 3 hours too. And so I hope you have a great, I think this is the end of the conference. I think this is it. I am it. And so it has been I'm so thankful for the invitation to be here. Thank you for choosing to be here. And I hope that you're able to get those slides next week and really take care of yourself. So y'all take care, be safe, and thank you so much.